We're talking about fatal child abuse, and one of the phenomena that we see during this fatal child abuse is the skeletal damage. So, if there is a superficial injury, of course, we're going to suspect that there are some deeper injuries as well. If we see bruises of different shading in a child, that is basically going to point out towards the fact that the child has been subjected to continuous child abuse phenomena. So, if you're carrying out an autopsy, or even if you're working as a forensic practitioner, as a medical legal officer, and you suspect a case of child abuse in a particular at a particular point, you see that there are a lot of bruises on a child, you're going to suspect that there is some sort of skeletal damage as well. What would be your next step? In such a case, you're going to find out whether there is some sort of fractures or comminuted fractures in such a case or not. Such an investigation will basically lead towards the fact whether child abuse has been sustained in a particular case or not. One has to basically keep in mind while investigating such a case of child abuse that usually the people involved in such a case are the caregivers. They are even the parents, the mentally ill mother can even be proving fatal for a certain child. So in such a case, one has to be very efficient, and the investigation has to be carried out in a particular way because it's quite a sensitive issue. At a lot of places. In this section, we'll be discussing the amount of skeletal damage that can occur in such cases of child abuse, and what are the different features in such a case, what we'll be looking for, how can we date a certain kind of a fracture. If we see fractures, basically any type of fractures can be observed. It can be a depressed fracture, it can be a comminuted fracture. All of these fractures are very important, and basically if there are loosely fitting or loosely reuniting fractures, that is basically going to indicate towards the fact that no proper care was given after the fracture took place. So the reunion is again very important, and one should know the background knowledge for this. The bone diseases, if the child is suffering from, there are a lot of bone diseases, basically, for example, osteogenic imperfecta, that has basically 4 grades involving, grade 1, 2, 4. So these are basically the different grades, and they have their own severities. Sometimes the child is suffering from this kind of a disease, and this disease is confused with the fact that the child is subjected to abuse, and there are a lot of fractures involved in such a case. So infant fractures are again quite common in a lot of cases of abuse. So even that has to be kept in mind, and one has to basically keep in mind that even the infants and the neonates are subjected to different kinds of abuse in these cases. Now, the different types of fractures that one can observe are the transverse fractures. Then we can have the linear, the oblique non-displaced fractures can be there. Then we can have the oblique displaced fractures. We can have the spiral fractures in a lot of cases. Then we have the green stick fractures that are not easy to diagnose basically on the radiographs. It's quite difficult to diagnose these green stick fractures. Then we have the comminuted fractures in a lot of cases. So even that can basically point out towards the child abuse, that it has occurred or not. Post-mortem imaging is one technique that can be employed in a lot of cases, and that is basically going to point out or give the evidence towards the child abuse. Then we can have the radiological skeletal survey prior to the autopsy, and before opening up the body for autopsy, one has to carry out this radiological assays. Wide range of injuries are found on bones whenever we are suspecting such a case of abuse. Fractures of skull, this diagram is basically showing you one of the displaced fractures of the skull, and we can have non-displaced fractures of the skull. We can have depressed fractures of the skull. If the tables of the skull are pushed downwards, that is basically defined as the depressed fractures of the skull. So depending upon the head of injury, depending upon the amount or the severity of the head injury, it's basically going to relate towards the fracture and the type of fracture. The skull fractures with intracranial hemorrhages are commonly found in a lot of cases. Fractures in the occipito-parietal areas are the most common areas that are involved in such kind of fractures. Parietal bone may dimple inwards without cracking phenomena. So this is basically a diagram that is basically showing you, it's a flow chart, whether or not certain kind of basically observations are carried out or not, whether the CT scan should be implied in a particular case or not. If we have GCS starting from here, if we have GCS less than 15, palpable skull fracture is there, then scalp hematomas, they're also very important. We have to look for them, and not acting normally per parent. So if the parent is obviously telling you that he's not acting normally, you are basically going to go towards the CT scan making decision. This is again going to be basically an AIMS criteria that we have to look for. We have to look for the signs, we have to look for the GCS criteria, and as per history by the parent, we have to decide whether the CT scan or the MRI has to be performed in a particular case or not. The fracture lines are again very important in a particular case. Horizontal cracks running backwards from the frontoparietal sutures, they're again very important. Occipital fractures, they're again important in a particular case. Then we have the sutural diastasis. This is also one of the phenomena in which the sutures are basically not aligned. There is a non-alignment in the sutures, and that will be looked for in a particular case. Then we have the limb fractures in a lot of cases. The growth plate is sometimes involved, and it's very important. When the growth plate is involved, these fractures are basically known as the Salter fractures. That is the terminology that is commonly used, common around the metaphysis and the epiphysis of the growing bone. So these are the areas that are commonly involved in such type of limb fractures. Then we have the indirect bone injuries as well in a lot of cases. Then we have the avulsions of metaphysis and the chipping of the edges of the metaphysis or the epiphysis. So all of this discussion is basically pointing out towards the fact that the growth of the child is going to be retarded if such fractures have occurred in a lot of places. Epiphysis may even separate from the metaphysis at this level, and all of this is basically going to hinder the growth of the child or the growth of the individual in a particular case. Then periosteum lifts where there is shearing or traction injury. So the radiological features that we are going to look for in such a particular case of limb fractures are, there will be soft tissue swelling, bony shell is extending along the shaft, and the bucket handle loop effect is going to be present in these cases. This is also another diagram. Basically, this radiograph is pointing out towards the fracture line, and that is basically pointing out towards the periosteal thickening secondary to the subperiosteal bleeding. So subperiosteal bleeding is again another phenomena that is going to be highlighted, and that has to be looked for whenever you look at a radiograph and you're suspecting fractures in a child abuse case. Spiral fractures of the diaphysis, there again another phenomena that is seen. Damage to the chest case. So this is basically a diagram that is pointing out towards the structures of the chest cage, including the sternum, including the rib, including the inflamed cartilages. All of these are the different phenomena involved in a particular case. So damage to all of these structures can occur depending upon the case and depending upon the severity of the abuse that has occurred. It can be a fresh injury, or it can be an old injury as well. And then the old fractures, there's a sequential callus formation in such a case. String of beads appearance is found in such cases of the chest injuries. Antero-posterior pressures are found. The rib fracture in the axillary line is again one of the important features in such a case. The dating of the fracture is again very important. Callus is sometimes quite visible. If we're talking about the upper limb, callus is visible around 2 to 3 weeks, then there is reunion around 4 to 6 weeks, and then there is consolidation around 6 to 8 weeks. Talking about the lower limb, callus formation is about the same time period, and the union, it takes almost 8 to 12 weeks. That is almost double the time period than the upper limb, and then the consolidation takes place almost 12 to 16 weeks after that. Marked differences in the appearance and the radiology is noticed in such cases of fractures. Bone healing is rapid in the healthy children unless there is some sort of a deficiency. Histological appearances are very unreliable in such cases. The different types of bone diseases that we were talking about, they basically include the osteogenesis imperfecta, and it can be the deficiency of copper, infantile cortical hyperostosis, that is also known as the Caffey's disease. It's again going to be a bone degenerating disease. Congenital syphilis, copper deficiency, Menkes syndrome, that is also known as the kinky hair syndrome. So it's basically we have the brittle bones. And all of these are basically the diseases that are pointing out towards the fractures which are quite easily applicable in such children who are suffering from such diseases. So in this section, basically, we dealt with the different type of skeletal damage that can occur at whenever we are suspecting child abuse in such cases. What are the different types of fractures that can occur, and the underlying metabolic diseases that can enhance the fracture states. That is the end to this lecture. Thank you for watching sqadia.com.